step one of the assessment phase in the Strategic Prevention Framework. Thank you all for joining us today. And this meeting is being recorded. It will be sent out. So if you haven't registered, make sure that you do get registered so that we have your email information and can send that out to you. We want to mention that this event and all of the webinars in this series, PTTCs are funded by SAMHSA, the Substance Mental Health Services Administration. I'm Wanda West, and I will be the moderator for your training today. And I will introduce our trainer in just a minute. So here's our learning objectives for today. And as I said earlier, we are taking the outline for this training from the SAMHSA's guidebook on the Strategic Prevention Framework. And so these objectives are taken pretty closely from that guidebook. So first we're going to learn how to assess substance use problems and related behaviors. We're going to identify the criteria for analyzing the assessment data and determine priority and how to determine priority problems and related harmful behaviors. Now, going back to that poll question, and some of you have completed an assessment already, so you may know how to do some of these things. But we have an amazing presenter today that there may be some additional ideas that are added to the experience that you've already had. And you may also have some ideas yourself that you want to share in the chat box. And then describing how to assess the risk and protective factors that contribute to the problem. So we'll talk a little bit about risk and protective factors as well. Now, I told you that we have a presenter today who is fantastic, so I'm going to tell you a little bit about him before he starts our presentation. This is Kyle Barrington, and he has over 30 years experience in the field of substance misuse prevention and treatment. His experiences include being a substance abuse counselor, director of a dual diagnosis hospital unit for adults and youth, director of an emergency shelter for runaway and homeless youth, and an evaluator for local and statewide organizations. Dr. Barrington has extensive experience evaluating the impact of alcohol and drug abuse prevention programs and practices. We feel so fortunate to have him today as our presenter. He has published 5 peer-reviewed articles. He's been quoted in several scholarly articles and has conducted over 200 program evaluations. Impressive, Dr. Barrington. We're so thankful to have you on the call today. We're going to turn the time over to you now for our presentation. Thank you so much. And thank you all for being here.
Well, Wanda, first and foremost, thank you for that nice introduction. It is always odd to hear neat things being said about you, particularly as a father of 3. It's very rare that happens anymore now that they're all in their teenage years. So first and foremost, I want to welcome all 117 plus participants on the phone line. Based on our initial assessment, it looked like we are represented by at least 18 different states, stretching from New York all the way to Washington State. And as far look like north as I was looking up there, I think we even had Maryland as far north in New York, all the way down to Texas, so exceptional representation and group. If you are not excited by assessment and community needs assessment, man, I really do not know what will get your adrenaline running, because this is something that I truly appreciate and truly love to do. The idea of being able to uncover a little bit about what's happening in your community and to make sure that those precious resources that you received in order to help address some of these problems are actually going to the right place in the right time. So a little bit in terms of that background as we go through here is just to understand that this concept of actually doing a community assessment that aligns with where we put our resources is new. In a lot of cases, we take it as common sense, But I can assure you back 30, 40 years ago, even and much further than that, but even that recently, we didn't do this. This was something that was unheard of. The idea that we could even find this data and use it in a good way is really something that's come out in the last couple of decades and has been refined by data-informed decision-making principles and evidence-based practices. So you're about to go through a process in your community that I think will not only benefit you personally, but will have a significant impact in your community for years to come. So as we go through that, let's get started into this process of assessment. To do that, we got to understand a little bit about what the strategic prevention framework is, and it really is just a framework. It's a series of steps that is a living, breathing process, meaning it's never really done. It's kind of like in my expectation, it's like raising kids or staying in a healthy relationship. It is something you have to work at. It is something that you have to continually get better at doing. And your next greatest assessment will be the next one that you do, because we're always learning from them. But this is the strategic prevention framework. It's assessment. Then we look at capacity, planning, implementation. And once we implement, we need to evaluate. Once we evaluate, we need to go back through again and make sure that we are able to sustain what is working and that we are always culturally competent with the information that we have, the way we disseminate it, and the practices for implementation. Then once it's done, we go back through this process again because our community assessment continues to change. If you don't believe that, we know that 2020 is a new census year, and the data you get this year from your census will probably look significantly different than what happened in 2010, and that will be a reflection of an updated assessment that will need to be conducted. So as we go through that process, the strategic prevention framework steps we just talked about. Evaluation, of course, is near and dear to my heart. But as we go through this process, then when we start with assessments, it's really just to identify what data you have in your community. And so as you go through that process, we need to be able to articulate to not only people in your organization, but the people you meet in the elevator, at the restaurant, just in your day-to-day interaction. If you have kids in the school, when you're talking with them, what is going on in your community? What are the biggest issues in the community? And are you willing to address those issues as a community? And those are always important things to consider as you get into this assessment step. It's not just the data in and of itself. It's also evaluating whether or not you have the capacity or the willingness as a community to do a change. And that's always going to be an important process. You may have a significant problem, and we'll talk about some of those and behaviors related to those problems in your community. But if the community doesn't want to address those, is it really worth spending money on it? And that's going to be some of the keys that we get when we deal with assessment data. So as we move through this process, then, we start talking about assessment, and we try to figure out what it is. And really all assessment is attempting to do is to identify and prioritize substance misuse problems. And it used to be, when we started getting into it, it was just identify all your problems. And for those who deal in the grant world and write grants, we used to call this, still do to some degree, the statement of woe. It was just a list of issues of these things were happening in my community. And we found that that was really kind of ineffective because one of the things that occurs is every community has problems. Now, I tell you, I'm old. I remember Mayberry PD, which was a show back in the 50s and the 60s, so I'm dating myself a little bit, and I guess in the 70s as well. One of the things that occurred in it was supposed to be this ideal American community, but even in that community, they had problems. They had a holding cell for the town drunk. They had armed robbery. They had a sheriff's deputy or a police deputy who could only have one bullet at a time because he was incompetent. There are all sorts of things that are just resonant even in the ideal community. So every community has problems, so just identifying is step one. The second one is prioritizing those issues. What is our biggest problem and why? In some cases, those with the greatest magnitude, i.e. the ones with the greatest numbers, may not be the highest priority, and we'll talk a little bit about that. We want to clarify the impact that these problems have. We want to identify the specific factors that contribute to these. We normally call these risk and protective factors. If you're new to prevention and new to this space, those are terms that you will definitely learn to appreciate pretty quickly. For those of you who've been in the field for a while and understand risk and protective factors, we know everything relates back to those. And so we want to identify what are the specific factors that are influencing our issues in our community. We want to assess community readiness, and that is particularly community readiness for change, and determine the resources needed to address these problems. So really assessment becomes down to something that we do every day. I have a family, I need to feed them tonight, what am I going to cook? Well, how much time do I have? What do I have in the refrigerator? What did we have yesterday so I'm not redundant? You know, those kinds of factors that we do in our day-to-day life as a form of assessment, we do the same thing here. And so as we go through this process, it's just a little bit more structured and detailed when we get into substance abuse prevention. Because for most of us, we're on this call because you were funded. And because you were funded, that means somebody did a decent job of creating that statement of woe and identifying what's happening in your community, and you were able to link that statement with a plan. Now, one of the things I always say when we deal with assessment data and grant writing in particular is nobody gets funded because they have a statement of woe. Every community has that. You get funded because you have a plan to address it, and that's part of your assessment process, and that's that last piece there. Determine the resources needed to address the problem. Now you have some resources coming in, and that begins this process. So what do we assess? Well, that nature and extent, the risk and protective factors that influence these problems, and existing resources and readiness for community change. Those are really what we need to focus on in our assessment data. And then each year, if not sooner, we need to update that information as well. So task one under assessment is to assess problems and their related behaviors. Now, for some of us, this is a terminology change because we break out problems and behaviors. But that is really something that we've always done. We've known, for example, that particularly in college towns that our underage drinking rates and particularly binge drinking rates are generally higher than the average community that doesn't have a major university in it, as an example. So our problem could be binge drinking, and then the question becomes is what are the behaviors associated with binge drinking? Well, those behaviors obviously could be public intoxication, poor decision making, DUI, fatalities related to crashes, injuries as people are walking to and from the bars, those are significant issues. I live in a college town. I live in College Station, Texas, so one of the things that we know of is, unfortunately, about once a year we have a tragedy where someone is drunk and trying to cross a road and gets hit by a car because they're trying to jaywalk at the same time making poor decisions based on their level of alcohol intake. So as you go through there, we have the problem, and then we have the behavior related to those problems. So that's what we're attempting to assess when we break this information down, is problems versus behaviors. So some of the problems that we looked at, one of them it could be binge drinking. The other one is underage drinking. You could have polysubstance misuse, multiple substances being done, illicit drugs as well. So you need to identify in your community what are the problems that you have, and then you need to quantify to some degree those problems. How many people binge, how many kids are underage drinking, what is retail density might be another piece, polysubstance use, illicit drug use. Once you have identified those problems, then the next step is to identify the behaviors related to them. So the consequences of the identified problem, so what, as we already talked about, could be some of the problems related to binge or underage drinking or polysubstance use or illicit drug use. Those are the issues that we have that are problems. Now we need to quantify those behaviors. In a lot of cases, this data is already available in your community. You can get that information specifically from local places like police departments. If you're dealing with underage youth, you might deal with the juvenile probation department. If you're dealing with medical issues, you might go to the local emergency rooms. If you need to get additional data, you might be able to go to the health center or health department in your area, in addition to the county as well as to the state level. Now, one of the things that's always important to understand is we're talking about the issues in your community. So if you're using federal data to address, for example, state and national data to talk about issues in your community, that is not going to be as detailed as we need it. So as we go through it, it's okay to say at the national level, this is the percentage. At the state level, this is the percentage of underage drinking. In our county, it's this, but in this localized area that our community coalition is dealing with or our nonprofit agency is working in, then this is its rate. So you want to get as granular as possible. So the more detailed you have, the better off you are. And this is with anything that we do. If we are trying to talk to a doctor about our kids' illnesses and we're trying to assess them, it doesn't do us much good to say he has an earache. Normally, as a parent, we're going in to say the left ear hurts or the right ear is what they're pulling on. The same process here. We want to get as granular and detailed as possible with our data. Here's an example of what one of these charts will look like. So if we have across the top, we may have tobacco as a concern or alcohol or illicit drug. And then underneath those, we have illness, injury, and other. And so there's other cases, or in this case specifically called other, where we might have some additional problem behaviors that we have to deal with. And those behaviors might be environmental. It could also include money. In a lot of cases, it's going to be related to crime. Also, there's impacts at work. We know that kids who are using substances, including alcohol, usually have issues at school, particularly around attendance, truancy, as well as academics. Now, that's not always the case, but those are some of the correlations that we start to see. So as you move through this process, you want to have a chart like this that identifies the top problems in your community, and then you want to be able to start breaking those down by these individual behaviors. And so we want to start quantifying what is our cancer rate, what is the cirrhosis rate, what is HIV infection rate. And again, that detail is usually available at the county level, if not at the city level. And getting a hold of that data is something we're going to talk about in just a minute. So as we go through this process, you also see some similar problem behaviors related to substance use. For example, car crashes occurs with alcohol as well as illicit drugs. So as you go through there, in some cases you can get data based on either the coroner's office or emergency room that will specify, was it polysubstance use that that person had? You don't get the individual names, of course, but you can identify polysubstance use, whether it was an alcohol-related crash or a substance illicit drug-related crash. Same thing with crime as well. So as you go through this, these are the kinds of matrix that you want to be able to have to start quantifying what is really happening in your community. Now, in some cases, your grant writer and the committee that did this has already got this done for you, and you are a step ahead. In most grants I see, they have started this process, but they haven't completed it. And in many cases, they're using older data. Now, remember, when a grant is issued, the grant writer and that group that's writing this grant has usually no more than 6 weeks to write the grant. So it's released, 6 weeks later it's due. They don't have time usually to do a comprehensive assessment of their community. So they're pulling together the easily or the low-hanging fruit. Your job when you get the grant in to assess your community is to dig deeper and broader than some cases your original grant proposal will had time to do. So assessment should answer a couple of questions. The first one is, what substance misuse problems and related behaviors? So what are they in your community? So is it underage drinking? Is it illicit drug use? And then what are the specific problem behaviors that you have in those communities? There's definitely a correlation between a rise in STD, sexual assault related in underage drinking cases. So is it increase in the number of DUI cases as well? What are those related behaviors? So identifying those. Then how often are these occurring? So it's one thing to say we have a problem. It's another one to be able to articulate that problem in a way where it makes sense to someone. Our rate of DUI is 3 times the state average in our community. So the question then is, how often does this occur? And we want to be able to put that in a way, usually through using some statistics that puts it into a rate format where we can say 6 out of 100 or 10 out of 100 kids do X compared to our county or state level data that shows it was Y number of students per 100 that did this. So we want to quantify and answer what and how. So how often are these occurring? Once we have the what and the how, then the question is where. In a lot of cases, this helps us define what type of approach we need to have in order to remediate these issues. So if the process is occurring that is predominantly occurring on Friday nights after school, would an after-school program be beneficial? If it's happening on the weekends at the lake or weekends at the beach, what other programs or processes should we put in place? If it's a predominant one where it's around spring break, and there's been several communities, particularly on the Texas coast or any Gulf Coast state, One of the things that occurs is that a lot of cases they see an increase in DUI and related problems. So there's some environmental policies now out to help address those around spring break. So where are these things occurring? Because that's going to help you be able to determine down the line what is the best approach. So what, how, and where. And then finally, we want to identify who is experiencing more of these problems and related behaviors. Now, we know that they could happen to everyone, but at the end of the day, or at least most of the problems and behaviors that we deal with can happen to any segment of our community. The question is there an area that is overrepresented or underrepresented? And then we need to know why. So as you go through that process, one of the things that we're looking for here is who is experiencing more of these problems. Is it ninth graders? Is it ninth graders in public school? Or are they private school? Is it college-age students? Are those the ones that are having these issues? In a lot of cases, we also have to look at who's experiencing these problems based on the fact that we, some cases, have a lot of survey data, but we got to know who we're missing in our survey. We do a pretty good job of surveying kids in college, and we do a pretty good job of surveying kids in high school and the middle school. The question for some of our communities, but the real question is, what about kids who graduated high school but never went to college? How do we get that data? And how do we know if that group is experiencing more or less problems? If we're dealing with multi-generational and we're talking about older populations, do we have the latest data that shows what the trends are? For example, last week they came out with a report that said there was a significant increase in binge drinking in the 40 and 50-year-old white male population, which was historically pretty stable and now has seen a significant rise up in binge drinking. So that if you're in a community like that and you have resources, those are trends that you want to start thinking about in terms of how can you address those issues, in addition to all the other issues in other communities that we have. And again, at one point in time, you're going to have to, as we talk about later on, prioritize. What community should we address or issues should we address first? So what, how, where, and who? And these are the questions that assessments should answer, because at the end of the day, you're going to need the answers to these to be able to pick and to identify what your evidence-based strategy should look like and what is the most effective way to implement and address these issues.
Kyle,
so that's really
move on, we had a question by Antonio.
Sure. What did Antonio?
Is the impact of the substance problem similar to assessing the harmful behaviors associated with the substance misuse?
Yeah, on face value, yes. The idea is that the impact of the substance abuse problem is, when we deal with the term impact, we generally are talking about not only the devastation, but the quantity. And so one of the things that occurs is in a community when we deal with impacts, we are talking about usually not only the number of problems or the type of problems, but the number of people affected by that problem. So harmful behavior in and of itself could just be X, but when you deal with impacts, you take X and then you put it into kind of a ratio, if you will. And one of those examples is the number 3. So that could be a related problem, which is we had 3 DUIs last year. But if you put that in context, you can say, okay, we had 3 DUIs just in our small community last year for kids under the age of 21. Those 3 resulted in 3 fatalities. Now I have impact. So one of them is quantifying. The other one is giving you a little more context to it. Still other, when you deal with impact, is kind of a bigger term. We can sit back and say, in our community, our underage drinking rate is 3 times that of the state average. That is the impact of it. So same terminology. Basically, you're still looking at it. Impact has a slight statistical or evaluation piece to it that says you're trying to quantify impact across multiple audiences or multiple communities. And the best way to do that is compare your community to the county or the state and see if it's above or below. So good question, Antonio. I hope that helps. Did I miss another one? Are we good?
We're good, Kyle. Thank you.
Very good. All right. So, and I see Antonio is typing again, so we'll follow up with that. But as we go through that process of typing, let's talk a little bit about where to collect data. And, oh, very good. Thanks, Antonio. So as we go through this process, there's a couple of things and a couple of places to collect the data. In a lot of places, a lot of people get really concerned and stressed out about data collection. And I have found, now, of course, I've been doing it a while, that data usually is pretty easy to collect and go to your most common sources first. Don't get into creating new surveys or trying to find new data sources that haven't ever been existing before. Go to those places that you know exist and see what they have, and that will inform you about whether or not you have enough information to have a community assessment. So existing archival data sources, that could be the census data, that could be county probation department reports, local law enforcement reports, all of those kinds of things that already exist and usually available on websites for free are things that you want to be able to look at. Now, if you're not familiar with those archival data sources or how to use them, you can get some really good detailed information just on YouTube right now, particularly around census data. One of the things I do with census data is I look at educational underrepresentation in communities. So the data is there. It talks about the number of people with a high school diploma or less than a high school diploma. Then you could search that out in your community and even get it to a very specific neighborhood. And then you can look over time whether or not it's over or underrepresented with educational success or educational attainment. Same thing can be done then with your police department data and your county probation department data. Remember, police departments usually are going to defer the kids underage to the probation department. Most probation departments do collect that data across the nation we work with. We are usually able to get that data pretty readily. In the state of Texas, for example, they call it the caseworker reports. So what I do is I walk into a probation department, I introduce myself to the chief or their liaison, and I ask for their caseworker reports for the previous year. So I can get the state level report, and now I can also access the community level report. The other one is epidemiological work groups. So as you go through that process, know there's other people already in your community working on these issues. In some cases, they've created these epidemiological or data resource work groups who use data and look at data as well. And so getting to share that data of, hey, this is what I'm bringing in, what do you have? And usually that work group will include you. Look at local evaluators. Most communities have grant funds. Grant funds typically require evaluators, and evaluators are somewhat a good resource of data because they're collecting it and they'll be able to say, oh, the school district has this kind of data, look at it. So if you're dealing with those, evaluators are another good source. So if you know a few, definitely ask them about data and where they get theirs. Finally, the other one is grant writers, as we already talked about. Grant writers are usually really good about low-hanging fruit and collecting data from easy-to-get resources. Because remember, most grant writers are under time pressure, but they keep usually a pretty good record of data that they can access quickly, so that way when that 6-week time frame or earlier occurs, they're able to respond. So look at old grants, talk to the grant writers, see what data they have and what they keep up to date. And then finally, go to the community agencies and organizations in your community and ask for their annual reports. In some cases, they don't publish them like you and I would, or that other people would publish a police department statistical manual, but a lot of agencies do. When I was working with a runaway and homeless shelter, I was a director, and we published annual reports that we made available to anybody who asked for it, but you had to ask for it. We didn't have the capacity just to keep it out on our website or just have binded copies of it. But when people asked for that data, they could get it. Also, any of your public organizations in town, health department, any place or anyone that deals with Centers for Disabilities in your community, advocacy groups and organizations usually have their own data, and you can collect that. Don't forget your Head Starts as well. Every year, Head Start is required to update information about attendance and poverty rates and number of kids under the age of 5 who are low income that are served in that department, as well as the number they're seeing with disabilities. Again, their data would be important if that is an area that you're addressing. So archival, epidemiological evaluators, grant writers, and community agencies and organizations. Then your needs assessment has to look at what the problem is. So one of the things that we've been talking about right now is, hey, what are the problems? What's the quantified? Where is it primarily occurring? So what does the problem look like? But the other part of it is what resources do we need to solve it? And so one of the things that's important to note in terms of resources is you also need to look at is what do we have available in our community that can help address this? So if one of our problems, for example, is underage drinking and the behaviors related to that are significant, one of the things we could sit back and say, well, is it happening after school hours? So would an after-school program help us here? And if the answer might be yes, then you need to look at, do we have the resources for an after-school program? And if not, then you would either use the existing resources you have to try to create one, or you would need to go out and look for additional resources. So as you go through the process, remember your needs assessment is looking at the problem, but it's also assessing the resources you have in your community. And normally we're doing that by looking at gaps and fits. So if you're going through here and saying, hey, this appears to be the problem in the behaviors, one of the things we know is, for example, it might be an after-school issue. Do we have resources to address after school? If the answer is yes, then we might need to reassess, is that really the impact, or are the kids that are reporting, are they actually showing up? True case story, we were doing a community needs assessment. The community definitely needed an after-school program. We talked to the school district. The school district said, hey, we already have one. We've been operating it for 10 years, and we have almost 100% involvement in it. And when we went in and started looking at it, they absolutely did. They had one for 10 years, but it was only for elementary school kids that went to 5th grade. Once they hit 6 up, they didn't have after-school programs anymore, and they relied on kids to be participating in sports. The majority of kids did not participate in after-school sports activities, and so even though they had an after-school program, it didn't reach the population that was reporting the problem, and therefore the attempt was to expand that from elementary all the way through high school. So as you go through it, that's an example of looking at resources. All right, so that takes us to the questions of you, and in this case, we know we have, I think, 130 plus. Excellent. So what we'd like you to do is just briefly tell us what data you have, which is on the left side of the screen, and what data you're missing on the right-hand side of the screen. So as you go through that process, you might be able to have other people who can talk about what they've had, but we're going to open this up because of just the sheer number of people on the call. We won't be able to open up phone lines, but please go ahead and type in what data you know you have and what data are you sure you're missing. And I know it looks like we have several people typing. Regional needs assessment is something they have. Excellent. That means somebody got together as a region and put that together. Excellent. Epidemiological work groups. On the missing side, substance use trends by zip code. Yes. Okay, so local and community data is also a missing. On the have side, we have law enforcement, coroner's office, CCYS, and work groups. Very good. Don't forget your coroner's office. It is unfortunate, but a lot of data goes through there. The other place I would also recommend is hospice. Hospice organizations usually keep a good detailed record of issues that individuals are facing, particularly problems toward end of life. Missing side, county level substance use data, county specific data, PDMP data, parish specific data, law enforcement, rural county. On the have side, some people have been able to collect hospital data. Extremely difficult to obtain, but they do get it. One coalition is able to use the YRBS, Youth Risk and Behavioral Survey, or surveillance, depending on the terminology you want to use. Data from opioids, educational sector, very good. MISA 2018 data, DEA data, super. Excellent. So as we go through here, there are a couple of things that we want to make sure people are starting to see is that there is some data that people can get pretty quickly and easily based on their community. So some communities participate in the YRBS or are selected for YRBS. Other ones have local and state data they can access. So you want to know where that data is. Some have had some success with hospitals and some have not. So one of the things that occurs in there is there's some research and best practices on how to deal with hospitals in getting that data. And definitely face-to-face interaction with the local hospital administrator has been the ones that we have used when we've had resistance from hospital. And knowing what the billing codes are that you're looking for is how most hospitals report. So if they aren't directly funded for an opioid or overdose, knowing what the code is for charcoal infusion, which is one of the standard treatments, will give you some additional information when you walk in that says, I don't need people's names, I just need to know over the last year how many times was this code billed or was this code inputted into the system. Coroner's data is another one that definitely you want to be able to access. A lot of cases we're looking for rural or law enforcement data. One of the best sources of law enforcement data is the FBI. FBI releases all the way down to city level data and county level data as well. That has adult, particularly adult, but some juvenile related crime. If you haven't already done so on the juvenile side, definitely get a hold of whoever your juvenile probation or juvenile justice programs are in your community. Generally, those will have information already broken down. They may not have it by individual zip code because in the criminal justice system, one of the things that happens is, are we talking about the zip code where the individual lived or where the crime occurred or where the victim lived? So you get into lots of different ways of looking at that data, so we want to be very clear. All right. So one of the things that occurs as we go through here, quite a bit of prose of data that we have, definitely a list that's pretty consistent across the board on data that's missing. The one thing I will tell you is school districts typically these days are very open, or are much more open to doing substance abuse data surveys and surveys of youth than they have been in the past, if you can link that survey to the opportunity to apply for grants. A lot of superintendents now are really struggling for additional resources for their communities. Grants is one way to do that. So one of the things that you can say is, if we do this survey, the chances of us getting a grant increase. There's a community we work with that has a population of 2,000 students. They're up to over $44 million in new grant funding in the last 15 years. And that's because they do an annual, or one of the reasons is they do a survey every year of all students in middle school and high school. So as you go through that process, having that data and being able to show that it results in success and additional resource funding usually helps superintendent realize the value of that. Excellent. Well, thank you all very much for participating. This will definitely be a list then that what we want to be able to do is at some point in time add that going forward, maybe under capacity, where we talk about even more ways of collecting this data. So thanks for your time on that. So that takes us then from task 1, we're going to go to task 2. And so task 1 was basically collecting the data, and we wanted to be able to make sure we understood the problems and the behaviors related to it. So now we want to talk about task 2, which is prioritizing that data. And this is where we kind of get into the magnitude and trends. So when we analyze the data, one thing is to collect it. Now we want to analyze it. And one way we want to do that is how prevalent is the problem or behavior, and we call that magnitude. So what is the magnitude of the problem, or the impact, how prevalent and significant is it? How large an impact does it have on the people of the community, which is severity? And this is Antonio's question about impact, which is the magnitude and severity combined gives you that impact. How is it changing over time? So you have that trend data. And that's important to note. We want to know, is things getting worse, or are they getting better over time? And so as you go through that process, just a single snapshot in time doesn't tell me in what direction it's moving. And how willing is the community to want to change or modify the problem? And this is essential. We call this changeability. So as you go through the process, what you're trying to analyze is the magnitude, the severity, the trend, and then in terms of what we have to do to make a change in magnitude, severity, and trend, how changeable are we as a community? And changeability gets really significant, and we'll talk about that in just a second. So one of the things that occurs in this process is we have to have a team approach, and that team approach, and there are several reasons for this. So one of the things that occurs, it used to be that the powers that be made all the decisions related to collecting the data, and even after they had all this data, they determined what the priorities would be. We now live in a community where we have social media, and we have different segments of our community that have historically been underrepresented that we have to bring and need to bring to the table to be effective. So one of the things that occurs in this process, the idea that the mayor or one person is going to decide what the problem is and prioritizing on their own no longer works. So we need a team approach. And part of that process is to prioritize problems and behaviors as a group decision, not an individual decision. No autocrats here. And we want to build the broadest level of support possible for our prevention effort. So one of the things that occurs in that process, you may have a very dedicated advocate in your community that wants change in one direction, but the community understands it but isn't supportive 100% of that change. So as you go through the process, you want to bring them to the table with others to figure out what is the highest priority. It may wind up being what that advocate wants, But if you just allow the advocate to pick for you, then you usually alienate other people in the community. The idea of bringing the team together is that it becomes a team approach. So that way it becomes something we sit back and say, as a community, we sat down, and this is what we decided was our direction and our way to go forward. So teamwork is essential, and it's usually only after you collect the data that when you start analyzing it and you start presenting it that you get the team involved to prioritize those problems and behaviors. Your team members should include your community stakeholders, for example, that advocate we just talked about. Definitely representatives of the identified population. So if we're dealing with low-income individuals or high-risk communities, we want to make sure we have representatives from those. If we are talking about high school students, they should be on our group as well. Middle school students the same way, if that is the identified population we're addressing. We need to have epidemiologists available, as well as evaluators and representatives of community agencies. So stakeholders, representatives specifically of the identified populations, epidemiologists, evaluators, and community agencies. You get them all together, and they start looking at this data, and they start looking at what may need to happen. And so one of the things that occurs is they start talking then about changeability. And when we get into changeability, there are several things that we need to take into consideration. And this, to me, is vital in your assessment. You need to have a statement and a section in your assessment that talks about changeability. So assessment should address capacity related to the resources. Do we have the people to do it, the supplies, and community awareness? And are we ready for it? The knowledge of the substance abuse problem, the support of local lenders, and community attitude toward the problem. And to give you a real-life example, again, in another state we were working at, they just received a pretty significant chunk of change to do evidence-based implementation around not having kids drink alcohol under the age of 18. And part of the approach was getting people into the process of being able to support a social host ordinance, right? So we have definitely the problem was articulated. The behaviors related to that problem was significant. The rate of underage drinking in this community was significant. They got resources to address it, which was going to be leading toward the development and implementation of a social host policy, evidence-based practice. And at the first time they brought the community in after getting these funds, half the community walked out and started writing letters of unsupport to the local newspapers and television stations. And the reason for that is in this community there was a strong belief that parents should be able to parent their kids, and if the parent wanted children to drink, then they should be able to, and there should be no social host penalty related to it. So again, they had done all the work all the way up until they get to this point of changeability. And what had happened in this scenario, because they asked us to come in and evaluate it, is they had somebody who was truly advocate and a true believer in social host, but no one ever sat back and said, how many others believe this? And so all that money, all that time, energy, effort, and resources really was spent trying to suddenly change the attitude of the community that did not want to change. Now, when does change occur? Generally, change occurs over time or when there is a sudden, dramatic, negative impact in a community. And a couple of years later, 5 students were killed in a DUI-related crash where somebody was at a home. The kid was drinking at that home. They got in a car with their friends, and they wound up in a car crash in which all were killed. That changed the community attitude. So as you go through that process, we have to look at changeability. It would be great to be able to tell people, yes, we need to change this, and everybody believes that kids under the age of 21 shouldn't drink. But in some cases, that just isn't the mentality of parents. And if a strong number of people in the community believe that we shouldn't change that rule, why hit our head against the wall to do it? So as you move through that process, this was an example where we didn't, and that community didn't assess changeability. So you got to know it. So as you go through that process, will what we are proposing and what we are seeing, in order for us to achieve change, are we ready for it? And not only do we have the people and supplies and community awareness, but do we have a community attitude toward the problem for change? So one of the quotes that I always like, yes.
Can we go back for just 1 second? We had a question from Antonio.
Absolutely.
Is there a simple tool to assess the support of local leaders or attitude toward the problem?
I would say that the best one that we have run across, it's not a simple tool, but it is basically a survey monkey kind of process where you are asking several scenarios based on your community assessment. So your community assessment is going to give multiple directions. Once you identify, and usually it's your team that's going to come together and says, hey, we need to have the support of these 12 people to see if they're going to be in support of it. You can send out a quick survey monkey survey, or if your community, if your team will allow it, you assign each one to go talk or email or call those 12 individuals to get that feedback. Hey, would you support this approach? So the answer there is I have not seen a single simple tool that assesses it simply because there's such a broad breadth of possible outcomes and data and trends. But once you identify, hey, these are the key people in our community who need to support this level of change, then the answer becomes yes. And then that simple tool could be a survey monkey, or it could be a simple sending that teamwork out. Now remember, the other thing is once it's implemented, you get other people who all of a sudden become power brokers. So for example, when you implement a social host policy, then it becomes the attorneys and the police chief for wanting to push everything along into the criminal justice system or to the civil system. In a lot of cases, it stops there. So identifying who those true change agents are going to be will be important. Good question. So as you go through that process, once you identify key people in your community, you need to be specific that says, would you support this level of change? And if the answer is no, and it's the majority say no, you really need to go back and reassess. How important is it, and what's the likelihood of success? So that takes us to this quote, and particularly the last sentence: community readiness is just as important in addressing substance misuse problems as having tangible resources in place. So as we go through that process, it's vital that we understand that if the community is not ready for it or is unwilling to do it, then it's just usually not going to happen. The last quick story I'll tell you is I was dealing with a school district. This was many years ago. I told you I'm old. So one of the things that occurred, so it's in the 90s, so 1990s, a senior trip in this school district was a senior trip, meaning it was just seniors. And the historic tradition is that the school bus would be filled with beer, and wherever they wound up, the kids would be drinking beer along the way, and when they came back, they would have beer as well. The school board in late 1990 said, hey, you know what, we're not doing it. We forbid alcohol on our school buses, even for the senior trip. And so they passed an ordinance, a new superintendent come in, this new superintendent advocated for this change. It was controversial, split the community, but eventually it was passed. So as soon as the school bus passed the city limits, a sheriff department vehicle pulled up, popped the trunk, and filled the school bus with beer. So as you go through that process, remember, community readiness is just as important to addressing substance abuse and misuse problems as having tangible resources in place. You have to know in your community, are we ready for this change? So it's something that is what I think everybody in this call would say is probably highly inappropriate. Beer on a school bus was something that this community was unwilling to change, or at least key segments of it were unwilling to change until the mid-2000s. So as we go through it, something to consider. So as we move through there, that gives you a chance to assess it. We got our team together. They're starting to look at trends and magnitude, and they're also looking at changeability. So then that takes us then to task 3, which is assess our risk and protective factors. So now that we have all of this in place, what key protective factors have we identified that are either going to be a risk factor, meaning that it has an increased chance of or associated with a higher likelihood of the problems occurring, or a protective factor, which decreases the risk of that problem occurring. And if for those of you who are new to risk and protective factors, just think of it as heart health. As you get older, I know many of you are much younger than me, but as I get to my age and I see my parents, heart health becomes very important. So cholesterol and body weight becomes very important. So a high-fat, high cholesterol-induced diet is definitely a risk factor to heart disease. Healthy diet, Mediterranean kind of diet, if you will, seafood kind of piece with good exercise usually is associated as a protective factor, meaning it will decrease the likelihood of problems. We know the same thing with substance abuse. Increased risk factors are high densities of alcohol availability in our community or outlets. We know a risk factor is lack of educational success in a community or lack of after-school programs. Protective factors are engaged and informed parents, highly effective school districts, that encourage success across all populations and across all groups. So as you go through those processes, you can look at risk and protective factors, and you need to know how those play in your community. Because once you have the assessment data and you know what your community will support and change, and you find the right protective factor you're trying to embrace or the risk factor you're trying to reduce, then that moves you into the next plan, which is the next part of the process, which is actually then capacity and implementation pieces. So you need to know what these two are, your risk factors in your community and your protective factors in your community as well. Because what we do with those, these are examples of those risk factors. Low or insufficient parental monitoring is always usually a highly correlated one, and so if you definitely can get that, that's important. We also see that a lot in communities where there's a lot of grandparents taking care of grandchildren. That becomes areas where we have to do a lot more in terms of parenting and resources and supports. Examples of protective factors, high perceptions of harm. Most kids believe that nothing is going to hurt them, so once they know something does, they usually avoid it. And so as you go through that process, important, that is a very key protective factor, as well as physical activity. Then that will take us on to then what? So we got this information taken care of. We got our risk and protective factors. Well, once you have all of this together, and these are important, we want to develop a full report. So you want to write up all the data you have, how you analyzed it, what the team came together with and prioritized. Hey, this is more important than this, and this is our priority as a team. And these are the risk and protective factors that we need to address to impact those priorities. You want to have the report approved by that team and group, so it's not just that they were part of it, but they actually physically said, yes, this is something we approve. Once you have that team approval, you want to highlight the key findings of it, because not everybody's going to read that long report. It could be 10 pages, it could be a couple of hundred, whatever that report is. You want to have the key findings kind of in an abstract. Just remember, your abstract usually should be no more than 2 to 3 pages total. Shorter, the better. Tailor the report to different audiences, and this is one that we typically forget. Remember, we have a community. The community wants usually is broken up into different interests and subgroups. You want to make sure that you tailor that report and tailor presentation specific to that audience. They don't need to hear about things that they're not interested in because you'll lose them. You want to solicit input from the community and make sure before you present this outright that different segments of the community had a chance to read it and are also okay with the findings of it. What you're looking for here is avoiding the law of unintentional consequences. So having other people read it and review it to make sure the terminology is correct. It also goes back to the SPIF-SIG around cultural sensitivity, making sure that how we report data is respectful to all. And just remember, the best community plan is your next one, right? And so as you go through this process, it's important to note that you're going to do a good one this time, but what you learn from this one will be applied to the next one. The only time I do not want this ever to be that the next one is better is I never want my wife to say that about her husband, right? I want her to be happy with this one. So as you go through that process, the next one is always your better unless you're my wife, and then hopefully this is good. So I think we will leave it there. I will turn it over for questions at this point in time.
Wow, we have received some awesome information. And there may be many questions, and if we can't get to all of them today, we will definitely follow up through email. So go ahead and feel free to type in your questions in the chat box, and we'll see how many we can get to. So Diana says, I was pulled away from the presentation. Okay, will the presentation be provided to us? Yes, we will have a recording of the presentation today, and we will email that out. As well as the PowerPoint. Please stay with us for just a few more minutes. We would like you all to complete an evaluation. Okay, so we do have a question from Antonio. How do you typically get feedback in the final report?
Well, the way that we have done that is we've actually done focus groups where we've done different presentations for representatives of the community. The other part is the key findings were highlighted, and we had a community night before the official release, and it was kind of an hors d'oeuvres and fruit juice and that kind of thing, depending on how big the community organization is and how large of an impact it has. And then simply the easiest one is we pick those highly involved and highly critical change agents in our communities, and we sent them the actual report and said, hey, please review this and let us know if there's any feedback that you have. And we would highlight the specific sections of the report that we knew pertained to them specifically. And so we would say something along the lines of, Martha, we know that this is a large report, but if you would just look over particularly pages 25 to 28 as it pertains to your area of interest in X. And we got a lot of good feedback that way. And it was just, when you're writing a report that's large and you have a lot of people looking over it, you get feedback about what is this acronym. But you also get things that says, hey, that's Latina is no longer appropriate. We prefer Latinx. Those are the kinds of things that you want to make sure that you get information back from. And then you can decide as a team how you best want to approach that feedback.
Okay, I'm not seeing any other questions, but again, feel free to email us and let us know. I'll provide my email address at the end of the webinar. We want to give you some information about the next in the series is Building Capacity on March 24th. Carlton Hall will be our presenter for that. Please get on our website, and I will show you. This link is the link to the South-Southwest mailing list and the Mid-America mailing list. And on both of those sites, you'll be able to register for the additional SPIF series, as well as sign up for our mailing list so that you can receive additional information about things that are happening around the region.